Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Warfarin. Introduction. Warfarin is a blood-thinning medicine. It reduces the body's ability to form blood clots. Your healthcare provider will give you enough warfarin to thin your blood without thinning it too much. Blood that is too thin or too thick can cause further problems. This program explains warfarin. It talks about how to take warfarin and when to call your healthcare provider. Use. Always take the dose of warfarin prescribed by your healthcare provider at the same time each day. Your healthcare provider will give you enough warfarin to thin your blood without thinning it too much. If the blood is not thin enough, blood clots inside the blood vessels and heart may form. If the blood is too thin, you risk a longer bleeding time. Longer bleeding can result in a severe loss of blood if the person is involved in an accident. Severe blood loss can be fatal. Take the amount of warfarin prescribed by your healthcare provider and check how thin your blood is on a regular basis. Instructions. To keep your blood as thin as it should be, you should keep your eating habits and exercise level consistent. Check with your healthcare provider before taking any new medicines, especially over-the-counter medicines and antibiotics. Tell all of your healthcare providers that you are on warfarin, especially if you are planning any type of surgery or injection. Taking warfarin while you are pregnant raises the risk of birth defects in the fetus. It can also cause excessive bleeding during delivery. If you are thinking about becoming pregnant, are pregnant, or want to breastfeed, talk to your healthcare provider about warfarin therapy. If you miss a dose of warfarin, do not take an extra pill unless less than 12 hours have passed since you missed the dose. Do not add it to the next day's dose. It is important to keep the amount of vitamin K in your diet steady. Do not change the amount of green and leafy vegetables you eat. You should eat small amounts consistently. If you choose to drink V8 products, you should drink them on a regular basis. Grapefruit and cranberry juice should be limited to 8 ounces or less a day. It is important to have your INR checked regularly. You may hear other terms such as PT, prothrombin-time, ProTime, and PT-INR. These are numbers that tell you how long it takes for your blood to clot. Your healthcare provider will tell you how frequently you should have blood tests performed. Some patients can check their INR at home. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. When to call your healthcare provider. Certain side effects of warfarin are normal, such as feeling cold and bruising more easily. Even if you are taking the prescribed amount of warfarin, dangerous internal bleeding or blood clots can still happen. It is important to tell your healthcare provider about any signs of internal bleeding or blood clots. You or one of your family members or friends should call your healthcare provider if you have a serious fall or you hit your head, especially if you develop a headache or if you become sleepy or weak. If you notice any blood in your urine or stools, or if the urine or stools turn very dark, call your healthcare provider. If you notice unusual bruising, large areas of bruising, or black and blue marks on your skin for unknown reasons, you should tell your healthcare provider. This may mean that you are bleeding under your skin. Small bruises that result from minor accidents, such as a leg hitting furniture, are normal and do not require a call to the healthcare provider. Check with your healthcare provider if you experience dizziness, trouble breathing, chest pain or pressure, more weakness or tiredness than normal. These can be the signs of blood loss and anemia. Call your healthcare provider when there is bleeding that does not stop from a cut or from your nose after 7 minutes. Contact your healthcare provider right away if you experience a rash, hives, itching, swallowing problems. Call your healthcare provider right away if you experience flu-like symptoms such as diarrhea, loose stools, nausea, you feel like you need to vomit, vomiting, throwing up. Call your healthcare provider right away if you have an infection, loss of appetite, pain in the upper right side of the stomach, yellowish eyes or skin. You should also call your healthcare provider if your hands, feet, ankles, or lower legs are swollen. If you are a woman who menstruates, tell your healthcare provider if you notice more bleeding than usual when you get your menstrual period or bleeding between periods. If you have a high fever or an illness that seems to be getting worse, check with your healthcare provider. You should also check with your healthcare provider if you notice any blood when you cough or vomit, or if you have loose or runny stools, or if you have an infection with high fevers and chills.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Warfarin is a commonly prescribed blood thinner. It helps reduce harmful blood clots in the body. Your healthcare provider will give you enough warfarin to thin your blood without thinning it too much. If the blood is not thin enough, blood clots inside the blood vessels and heart may form. If the blood is too thin, you risk a longer bleeding time. It is important to keep the amount of vitamin K in your diet steady. Eat a consistent amount of green vegetables every day. It is also important to exercise regularly. Even if you are taking the prescribed amount of warfarin, dangerous internal bleeding or blood clots can still happen. Report to your healthcare provider any signs of internal bleeding or blood clots. Call your healthcare provider if you notice unusual bleeding, bruising, dizziness, or chest pain. Communicating with your healthcare provider can help you use warfarin in a way that best treats your blood clots. Thank you for using Explain.